Hey, good morning, everybody. This is John. I apologize for the sweats I've got on this morning. I'm actually working from home, and family's flying out this afternoon for Thanksgiving. We're going to California. Um, uh, got some weather. Hopefully, the weather will permit us to leave. It's supposed to snow, I think 8 to 14 inches tonight, starting at 5 o'clock, and our plane leaves at 5:40. So hopefully we can make it out of here. So, anyways, I wanted to talk briefly about last week's discussion question and some things we've got coming up this week, and just some things that I think are valuable for purposes of a healthcare law class that are, I think, at least alluded to or discussed in some depth in your text, but we're not necessarily going to get to in our discussion questions or our assignments. So first, I want to talk about the discussion question from this past week. And I think last week I said, I told you that it's probably my favorite discussion question from the class, only because it sort of forces you into that analysis of what a breach actually means. So you had two different scenarios related to whether or not a particular fact scenario was a violation of HIPAA or the privacy rule of HIPAA. And the question is, what is a breach? So what I asked you not to do was sort of go into this instinctive mode, which I think a lot of us do, including myself, this instinctive mode of, well, that doesn't seem right, and so therefore it's a breach, which is not sort of the antithesis of a legal analysis. So in a legal analysis, your first question is, okay, first of all, what's the issue, right? So we're going through the IRAC method of legal analysis. What is the issue? Well, the issue is given to you here. The issue is whether or not there is a breach in both or either scenario. So the second question is, what is the rule? So the rule is is in the definition of a breach. So okay, so you got what is a breach, or the issue is if it is a breach, and then the next question is what is a breach. And so that there's a regulatory definition that I posted the link to that sets forth various factors that a covered entity or a hospital or a healthcare provider would have to go through to determine whether or not there was actually a breach. Just because someone's protected health information was used or disclosed in what would seem to be an inappropriate manner, that does not mean it was a breach. So you go through those factors, and then there are like three exceptions. You go through those exceptions. Do any of those exceptions apply? And the outcome is your conclusion. So you apply the facts from the discussions question that was given to you, apply it to the rule, which in this case was the definition of a breach, and then there's your conclusion. So this is sort of the microcosm of what I think is the biggest takeaway, and I hope you take away as the biggest value from this class. It's not necessarily learning healthcare laws or healthcare ethics. The biggest takeaway for me in terms of what value I think this class provides is sort of developing that skill, or thinking about things critically and thinking about issues like this in an analytical manner. So that requires you to go through that process. So again, I'm not super interested in the conclusions. Whether or not you think it was a breach is immaterial to me. What's material to me is sort of going through this process of this legal analysis. So, cite the rule, apply facts to the rule, and come out with your conclusion. Because the reason the conclusion is immaterial to me is because if your analysis is reasonable and you're applying the right rule, you're applying specific facts to that rule, your conclusion is going to be reasonable, and that's all that matters. Is if it's reasonable. So enough of that. And that's the same applies to the legal components of this iTeraldi project that we're working on. So I provided a bunch of feedback to different papers, this as I graded them this past week. And um, for the legal component section, that's where I want you to identify the legal issues in the case. For Dr. Ricketson, for example, the obvious legal issue is the negligence. Well, negligence, there is a definition of negligence that's given to you in the text, but it would be incorrect to say Dr. Ricketson was negligent because of X, Y, and Z facts. The reason that's incorrect is because negligence consists of 4 different elements, right? So you need to go through that IRAC form of legal analysis for each one of those elements. And that's important because if you have even one element missing, then there is no negligence from a legal standpoint. So if you go through, the first element of a negligence case is duty, or malpractice case. Malpractice is the same thing as negligence. So first element is a duty. Well, okay, was there a duty? That's the issue, right? So what's the rule? When is that duty created? And your text tells you that the duty is created when the physician-patient relationship is formed. Well, what specific facts from the case show you whether or not that relationship was formed? And so apply those facts, issue, rule, apply the facts. What is your conclusion? Yes, there was a duty. Okay, element 2. Element 2 is whether or not there was a breach of that duty, whether there's a deviation from the standard of care. So what's the rule? Well, what's the rule related to standard of care? Standard of care is defined as whatever reasonable, prudent. I don't remember off the top of my head, but your text tells you what that is, and so there are a myriad of facts from the case, from the opinion, that demonstrate whether or not Ricketson breached his duty. And so you come out, do that analysis, apply the specific facts, and come out with your conclusion. Element 3, causation, same facts, or same sort of legal analysis. And then 4th is whether or not there were damages, whether or not there was harm. And that's important because, for example, Dr. Ricketson could have done all kinds of things wrong, right? Just sort of mess things up left and right. And if there was no causation, so if it didn't cause the harm, or if there were no damages, then there's no negligence. And so from a legal standpoint. And so that's important. So just go through that analysis and in that legal component section, and that should work. And then the other question is, what are the legal issues pertaining to the other defendants? For example, the hospital. Were there any legal issues that pertain or apply to the hospital related to credentialing or not following policy or whatever it may be? So I encourage you to kind of look through the opinion to see what facts may apply there. Again, as always, and I told you this in the feedback for every one of you, I believe, please reach out to me if you have any questions or want to talk through anything. Please email or call or text or whatever, and I'll make myself available. So enough of that. So this coming week, we've got this discussion question regarding the discrimination. And as much as I love the HIPAA breach discussion question, I'm not a huge fan of this discussion question, only because it's not really healthcare related, right? So it's an employment matter that could apply to any sort of scenario, not just in the healthcare scenario. It's not really a healthcare law or ethics related issue. It's more of an employment law issue. But I think it forces you to go through that same analysis, which is good. So there's a rule that applies to the discussion question that you're asked to discuss this week, and you're given facts. So go through that same. If anything, it forces you to go through that same legal analysis as you're writing that letter. And I encourage you to do that. So take the time to go through that legal analysis, and I also encourage you to because you're required to respond to one person that takes an opposing view. In order to do that, some people are going to have to write a letter on behalf of the hospital, which I always get maybe one or two class members who do that. So I encourage you to, even if the taking the side of the employee is sort of the more sympathetic and easier position to take, and I understand that, but I encourage you to sort of just the process, the legal analysis is the same to write that letter on behalf of the hospital. So I encourage you to do that as well. Anyways, so just a few things I want to discuss. And really this week, again, this isn't really covered in your assignments or discussion questions, but I feel like just to kind of be as comprehensive as we can be, I want to talk about the economics of healthcare a little bit and just do a high level overview of some of the big topics of discussion related to this issue. So, what are the economics of healthcare? Obviously, it's a big topic of discussion. If you watch any of the Democratic presidential debates, if you watch the news, you'll see that it's a common topic, and it always is, because how you pay for healthcare, how you deliver healthcare, while there are ethical components to it, there are legal components to it, there are also political components to it. It's a highly politicized issue, and how that's done. So you'll obviously, and the closer we get to the election cycle at a national level, the more you're going to hear about it. So, how is healthcare paid for? Obviously, mostly through third-party insurance companies or programs. So you got private insurance, employer group health plans, which is the most common, employer subsidized private health insurance, and your PPOs, your HMOs, your EPOs. You also have self-funded ERISA plans. So as an employer, you have a choice. You can, if you're a big employer that employs a lot of people, you can choose to be a self-funded plan. So basically, your employees that enroll in your plan will submit healthcare claims, and you're going to pay that as an employer out of your own pocket. That's what a self-funded plan is. Now you're going to hire a third-party company. It's called a third-party administrator, TPA, to handle all the administrative part of the health insurance. And so they're going to receive the claims that are submitted by healthcare providers. They're going to pay those claims. They're going to sort of keep track of how much is spent. I mean, just anything that a normal health insurance company would do outside of actually paying the claims, they're going to handle. So that's how self-funded ERISA plans work. Now, fully insured group health plans is different. So an employer will say, I'm not going to insure myself. I'm going to pay like a Blue Cross or a Cigna to basically handle everything. They're going to pay the claims, they're going to administer the claims, they're going to do everything, and I'm just going to pay them a premium. So a lot of employers will do that. So it just depends on the employer situation which one they're going to choose. There are also individual exchange plans, and so that's a product of the Affordable Care Act, where a lot of states are required to have a healthcare exchange, where if you don't work for somebody or for an employer that provides health insurance or is not required to provide health insurance, then you can go purchase an individual exchange plan. And you can do this as well. So there are employers can also purchase plans on the exchange. Those are called SHOP plans. Don't ask me what I don't remember what that stands for, but there's SHOP. It stands for something, but those are essentially employer plans that you can purchase on the exchange for your employees. So that's on the private health insurance side. There are many government programs that are subject to additional regulations, things like Medicare, of course, that's existed since 1965. Medicaid, which is the state federal combined program in terms of being funded, combined program for state residents that meet certain income and asset threshold requirements. Medicare Advantage, of course, Managed Medicaid, which is quite popular now in most states, if not all states. The Medicaid agencies contract with Medicaid managed care organizations to administer the Medicaid program, and then TRICARE, federal employee benefit health programs, and things like that. Now, those are all subject to additional regulations and statutes like the anti-kickback statute and the False Claims Act. So at a federal level, there are additional regulations that are involved. For the private health insurance side, those are subject to different regulations and requirements, largely though based on state laws. So there may be a False Claims Act for private health insurance, but that's going to be based on state law, not federal law. And then the other components related to the economics of healthcare is really sort of the model of healthcare that's growing, and rightfully so. And that's sort of this concept of value-based population health, integrated care. You may have heard of accountable care organizations, right? So it's this integrated model of different types of providers. You got hospitals, you got primary care physicians, you've got specialty physicians that are coming together to treat a defined population of patients. And to the extent that they are able to provide that care under a certain cost threshold, then they benefit from some of that savings. So that's sort of the model that is getting more popular, and rightfully so, because there's probably more cost savings in that sort of model. So in terms of the business of healthcare, one thing that I deal with a lot, so I help a lot of clients form medical groups, a lot of companies that want to get into the healthcare business. There's this big obstacle in probably half the states in America called the corporate practice of medicine doctrine. What the corporate practice of medicine doctrine, against it's a state specific law, so it'll vary from state to state. It basically says that a company can't just go out and hire physicians to provide medical care, right? So just a regular, let's say you form a company, it's called, let's just say Walmart, right? So Walmart can't just go out and hire a physician to provide medical care to its customers or to its employees in some states. Now you're probably asking, that you're probably saying that's not true, right? Because Walmart is very much in the healthcare business now. They're actually providing care at some Walmarts in Texas and some other states. And there are a couple of reasons behind that. So some states don't adhere to the corporate practice of medicine doctrine is the first issue. The second issue is there are actually ways around it. And so the big way around it is what's called the friendly physician model. And that's one that we employ. I employ quite a bit to help companies get into the business of healthcare. And what you do is you basically, at your company, turns into a management, what's called an MSO, a management services organization. And you identify a physician who you will call the friendly physician. The friendly physician essentially is the sole shareholder, the sole owner of the practice. So you go out and form a professional corporation, a professional entity, and then that physician is the sole owner of it. So that professional entity then enters into a management services agreement with this company that you form. And the company that you form provides all the administrative services. It basically has total control over the professional entity, but doesn't own it, right? So the physician owns it, but is under certain restrictions. So the physician can't go out and sell the practice because the management services organization, this other company, has total control over it. And so this is the common way. It's called the MSO model, or the friendly physician model that basically helps companies get around this whole concept of a physician has to own the practice. Well, a physician can own the practice, but that doesn't mean the physician has to have total control over it. So a separate company can have control over it. So anyways, that's a common model that is used. And just a couple other things that just wanted to discuss. So some common fraud and abuse statutes and regulations that apply to sort of the economics and business healthcare are things like the anti-kickback statute. So that's a criminal statute that says you can't essentially, anyone, it applies to anybody, not just healthcare providers, but you can't induce, you can't provide, you can't receive, you can't have anything to do with, at least knowingly, have anything to do with providing anything of value in exchange for patient referrals that receive services that are paid for by a federal healthcare program. So that includes Medicare, Medicaid, all the healthcare programs that I mentioned earlier. You can't go essentially provide a kickback or any sort of discount or anything of value in exchange for patient referrals that are beneficiaries of these programs or enrolled in these programs. So that's a criminal statute. The other big one is the Stark Law. You may have heard of this. So that's not a criminal statute, but it's also known as a physician self-referral law. So it only applies to physicians, which is, again, a defined term. Includes podiatrists, includes a handful of other professionals, but it just applies to physicians. And basically, a physician can't refer a patient for certain types of health services, not all health services, but just for designated health services, which is a defined list of about 15 or so different types of health services. But the physician can't refer a patient who is enrolled in Medicare to a healthcare entity in which that physician has some sort of ownership interest or financial relationship. So, for example, if I'm a physician and I have, let's say I have a 10% ownership interest in an imaging company, I can't refer patients to that imaging company because I'm going to benefit from that, right? So I have all the incentive in the world to just start referring all of my patients to this imaging company. Now I can't do that unless an exception applies, and there are a bunch of exceptions that we don't have time to get into, but that's essentially the whole idea behind it. No, it just applies really to Medicare patients, but it also applies to not just ownership interest, but financial relationships. So one of the exceptions is a bona fide employment relationship. So you, like, for example, if I'm employed by a hospital, I'm a physician employed by a hospital. Well, technically, I'm referring to that hospital, right? So I'm referring. If I'm employed by the hospital, I'm providing services for that hospital. I'm probably referring designated health services to Medicare beneficiaries to that hospital. Well, that's normally contrary to or violation of Stark Law. But if you have a bona fide employment relationship, so you're truly employed by that hospital, that's an exception to it. So there are a whole bunch of exceptions we don't have time to get into, but that's a sort of essentially the gist of it. And there are a bunch of state laws that model the anti-kickback statute and the Stark Law from a state law perspective as well. So anyways, that's just sort of a brief overview of economics, business, fraud and abuse related to healthcare. Hope you all have a great Thanksgiving. If you have any questions, please let me know. Again, some of you, please consider and think about posting your discussion as an advocate for the hospital as opposed to the patient, so we can have some true meaningful discussion and collaboration with everyone. So anyways, have a great week and have a safe and happy holiday. Bye.